Welcome back to our EKG learning series, and in this video, we'll talk about Brugada syndrome. Brugada syndrome is an EKG abnormality that has a very high incidence for sudden cardiac death, and those patients will have a very normal heart structure. The problem is with the sodium channels found inside the heart, they have a mutation. Usually, patients who are diagnosed with Brugada syndrome, the mean age for sudden death is at the age of 41. And annual death rate is 10% for patients with Brugada syndrome. Now, just remember some facts about Brugada syndrome. It is only one type. There are no variants of Brugada syndrome. Number two, the cause is actually the mutation in the sodium channels inside the heart cardiac myocytes. And this mutation is called sodium channelopathy, in which there is a problem with the channel itself. Just remember that we have more than 60 different mutations can affect the sodium channels, and 50% of these mutations is actually spontaneous. But just remember that they can be inherited as well in autosomal dominant pattern. Okay. Whenever you're making diagnosis, you cannot only use the ECG. You have to have some clinical criteria. We will talk about this now. And whenever you diagnose a patient with the Brugada syndrome, the definitive treatment is actually the ICD, which is implantable cardioverter defibrillator to prevent cardiac death. All right, let's talk about the EKG findings in Brugada syndrome. In Brugada syndrome, we can see three different characteristics in the EKG: type 1, type 2, and type 3. They are not variants of Brugada syndrome. Brugada syndrome is only one syndrome. These three types are actually the patterns that we recognize in EKG. The first pattern, which is called type 1, is also called the Brugada sign. This is the only diagnostic sign that we can see in the EKG. The other signs are only suggestive for Brugada syndrome. And whenever you have the other signs, you have to do an electrophysiological study, EP study, to diagnose the Brugada syndrome. Okay, just to stress this out, the Brugada sign is the only diagnostic sign in the EKG for Brugada syndrome. And yet, if you have Brugada sign, you still need a clinical criteria to diagnose Brugada syndrome. Okay, so what is type 1 or a Brugada sign? Brugada sign is actually an ST segment elevation, more than 2 small squares, and at least 2 leads of V1, V2, V3. So I need 2 leads of them, either V1 with V2, V1, V2, V3, V2 with V3, V1 with V3, whatever. Okay, you need 2 leads to have an ST segment elevation in that is more than 2 small squares. And this ST segment elevation should be followed with a negative T wave. Okay, let's see here. If we look at V1, you can see that there is a peaked ST segment with a negative T wave. Peaked ST segment with a negative T wave. The V3 is normal, actually. There is a small elevation that is less than 1 small square, so it's not counted. So this patient has ST segment elevation in V1 and V2, and with look for the negative T wave as well. This is diagnostic. This is the most diagnostic sign that we can see in Brugada syndrome. Yet, you can't say this patient has a Brugada syndrome. You have to have one additional clinical criteria. We'll talk about it now. All right, in this video. So again, for Brugada syndrome, we have something called diagnostic criteria in the EKG. Type 1 diagnostic criteria or a Brugada sign is the only EKG abnormality that is potentially diagnostic. And you need one more clinical criteria to diagnose a patient with Brugada syndrome. The other 2 types, type 2 and type 3, are not diagnostic at all. And you need to do an EP study in order to diagnose patients with Brugada syndrome. Okay, so what is the type 2? Type 2 is actually, you can see more than 2 small squares. And the shape of ST segment is different. It's saddle back, just like the horse back. Okay, I will show you a picture of it. And it should be like in at least 1 lead, either V1, V2, or V3. Okay, type 3 is the same. It could be of any morphology, but the ST segment is smaller than 2 small squares. So type 2 and type 2 morphologies are not diagnostic. Let's look at the type 2 morphologies. If you look here, we have this beautiful ST segment elevation. Look at it, just like the horseback, right? So it's elevated because this is the baseline here, the isoelectric line, and it's almost 3 small squares. So it is more than 2 small squares, and just like it's the shape of the horseback. Okay, we can see a little bit of elevation in V1, which is less than 1 centimeter, 1 small square. Okay, so this is not ignored here. So this is type 2. Again, this is not diagnostic, even with the clinical pattern, even with the clinical criteria. You need an AP study for this. Okay, so how we can diagnose the Brugada syndrome? To make the diagnosis, you need type 1 features with one of the following criteria. Okay, let's talk about these criteria. One of them is sufficient. One is nocturnal agonal respiration, in which the patient during the sleep, they will have they have apnea, they are not breathing. And when they get acidotic, they will get a very deep one breath, okay? And they will have pause after that, and after that, they will have another breath. That seems to be because of the sodium channelopathy itself, even in the medulla that regulates breathing. Okay, because the same sodium channels are found also in the brain. Number 2 is family history of sudden cardiac death at age less than 45 years old, because it can be autosomal dominant, as we said. Documented VFib or VTAC. If the patient has any history, if he get like any history of VFib or VTAC, this is also one criteria. Type 1 ECGs, like the same Brugada sign in one of the family members. This is also diagnostic, and it's one of the criteria. Inducibility of VTAC with programmed electrical stimulation. Sometimes we send those patients to the EP lab to give them electrical impulses. With these electrical stimulations, they will enter into VTAC. This is diagnostic. And syncope. If the patient develops syncope, and you have to place implant ICD to prevent sudden cardiac death. That's it about Brugada syndrome. Thank you.